Well, good afternoon, everybody. Thanks for joining us again today. Today on Let's Talk About Cancer, we have Mindy Griffith from Bagot. She's the executive director. My name is Dr. Monica Yellowhair, and I work with the University of Arizona Cancer Center Community Outreach and Engagement. And today my co-host is also Ms. Desiree Jones. And so with that, I'd like to extend a warm welcome to Mindy and let her introduce herself.
Good afternoon. Thank you guys for having us here and having the opportunity to share Bagot on your afternoon webinar. So we're excited to do that. I am Mindy Griffith. I'm the executive director of Bagot. And so I do a little bit of everything. We have a great team that supports everything that we do. And we tend to have two programs, the Bagot Bag and then our Escape to Thrive Leadership Conference that I know we'll talk a little bit more about both of those.
Great, thank you. So what is Bagot and how do we get started?
So Bagot was founded in 2003 when our founder, Sherry, was diagnosed with cancer and at the time was given very little information. So there wasn't a lot of information to give. And so she went home and was like, how do I cope with this? How do I talk to my kids about this? She's a school teacher. How do I go back to work and everything? And so she wanted to give more after she got through her treatment and to give back to the community. And so she started, she'd been a teacher, so she put together a binder, which I actually have one here. Looks a little bit different here 17 years later, but put together a 3-ring binder with some basic information in there to help organize all the test results and everything that you get. And then worked with some of the national cancer organizations to get some content, some booklets on how to cope with your diagnosis and just giving some more background information. And so she started putting them together in her room with friends and family at her house and kind of has stemmed from there. And so it's still the same basic idea of a binder to help you organize all the content that you have, but also materials to help you really designed to empower the patient so that they can feel a little bit more knowledgeable and more comfortable speaking up and being a critical part of their healthcare team.
Great, thanks.
Thank you. Welcome. And I wanted to ask, what types of services or resources does Bagot provide?
So we have the Bagot Bag, and it has 4 publications in it. So it has one that is called Taking Time, that is designed to help sort of deal with the emotional aspect of having a cancer diagnosis. There's a publication called Heal Well that has information about eating both during and after active treatment, as well as physical activity, because we know how important both of those components are. And then there is one for the caregiver, because so often our caregiver is a crucial component in this and might often be organizing the bag or the materials or just being a support system. And so we know that they need to be taking care of themselves as well. And so there's a booklet in there for that. And then we also have one that has some basic information. It covers common side effects. It talks about questions to ask your healthcare team. We talk a lot about we don't know what we don't know. So you don't ask questions because we don't know what questions to ask or what the terms are. So there's a glossary and everything in the bag, and then the organizational part. And then in addition to, it's a printed material because people have told us that they still really like it available, something they can hold in their hands and have. But our website, bagotcancer.org, has all of the forms that are in the bag. It has all of the publications, so you can access them there. You can print them or download them there. And then we have a resource page that has over 150 different resources on it and continuing to grow. We're always adding to it, but it has direct links for people to financial assistance, because we know how difficult that can be. Specific cancer types. So Bagot encompasses general cancer and does not, although we've recently partnered with some specific cancers. But so we link, here are some great resources there. Because we need a starting point. And so going to the internet can be quite overwhelming and knowing where to start. And so we've tried to narrow that down a little bit on our resource page.
So the information that is in the bags, are they also available in other languages?
Yes. So the bag is completely translated, and everything is in Spanish as well. So we have it currently both available in English and Spanish. And all of those materials are printed and on the website in English and Spanish. No other languages as of yet, but possibly in the works. You know, we would love to do that, and if there is a need there, we know that getting content is so important in your own language, that medical, for me especially, but medical terminology is its own vocabulary. And so if you're trying to do it in your second language, then it's even more challenging. So anything we can do to support those individuals.
Awesome. So, how can someone, say someone who may just been diagnosed with cancer, or a caregiver or family member of someone who was diagnosed, how can they get one of these bags?
So we try to do a number of different ways. We want to make the bag as accessible to people as possible. And so we've worked with, over the last 17 years, worked closely with medical providers in Arizona. And so a lot of the medical providers will give the bag out on their own. So they work with us and they have them at their office. So that way people are getting them when they are first diagnosed. We know that fortunately people are living much longer after a cancer diagnosis and after treatment. And so we've extended content, but people are getting it from their medical provider. So whether they just give it to them or they can ask if they're familiar with it, all of the Arizona oncology offices locally give them out. They have information at the U of A Cancer Center about the bags, and people can then order them online. We do have a spot on there where people can gift them to someone else. So we're seeing a lot more people across the country as we start to expand that way, where they might order one for a friend or a family member or a colleague as sort of a gift, if you will. Like, here's something, I can't be there right there with you to take you to an appointment or to help with the kids or something, but here's something that I have found helpful in organizing my materials, and we can ship those directly to people. And so they can place that order online. We also make it available because we know there are individuals that want a bag that maybe their medical office doesn't offer it, or they don't have the suggested contribution to help cover a portion of the cost. They can fill out, there's a simple form on there that doesn't ask any financial information. It's more just their address and everything, so that then we can just ship them a bag directly in either English or Spanish. So they can order it online, they can call us, and we will help them get one to them, or through their medical provider if they are offering them.
Do you by any chance also work with like other cancer survivor support groups maybe to help them send out the bags as well?
We've actually started partnering with a couple of different, so we have a couple of organizations. I was telling you guys right at the beginning, there's a cancer support group out of New York called Share, and we've had some sponsors that have contributed the funds to help cover the cost, and so they give them out to patients in their support groups, to individuals that they're talking to and supporting. We have another couple organizations that have attended actually the Escape to Thrive Leadership Conference, and so we've developed some of those relationships, and they know the value of it, and so they have ordered them, some of them exactly as is, and are giving them out. And then some of them are also, we're customizing them. So we have one that is specific to stomach cancer. So we've partnered with a nonprofit out of Los Angeles where there's a heavy diagnosis of stomach cancer there called Hope for Stomach Cancer. And so it's a little bit, it's a lot of the same content, and then there's additional information on stomach cancer. And then she is working with medical providers she knows focused on stomach cancer, both in LA and some other places across the US. to get those bags in their hands so that they can give them out to their patients. We've just done a bag focused on CLL and on MPN, and I could say those, but I butcher the names every time I do. But those two specific cancer types, and have partnered with an organization called Patient Power for some of the town halls they do on those specific cancer types, as well as some other organizations for the content involved in them. So that is some ways that we're trying to get it available. And then working with trying to reach out to other medical providers. So the bags, we work here in Tucson where we've been founded, is obviously a little easier when it's right there in your back door and you can pop in. And now that we're all used to Zoom meetings, we can meet with everybody anywhere. But we have a hospital in Nebraska that is that's doing a customized bag that they are putting together for their patients, that they will then use all of our content, but then add in their own. So what we find is a lot of nurse navigators and medical providers really like the bag, and they're doing something similar by helping patients organize their information, but it's the extra educational pieces and the forms and helping people keep organized that way and think through things that they really like about the content in the bag. So
that's great, just to know in case if like a certain community is interested, like if they have a higher rate of colorectal cancer, that you guys can make those bags more specific to whatever their needs are. So that's really cool.
Yeah, we're very much about collaboration. Our goal is to make sure that those with cancer have the educational information that they need to feel a little bit more in control of what's happening and do their part. We know that we as the patient have to be involved in it. It can't just be left up to the medical team. And so the more tools that we can give one to help them feel feel better about it and to speak up, then we want to do it. So we're willing to work and partner with anybody.
That's great to hear. So, are there any way, do you have volunteer opportunities at your organization? And what do volunteers typically do when they decide that they want to give back to your organization?
That's a great question. When we started, I think I said when Bagot was founded, volunteers used to be really involved because they were like going to the founder's home and putting the bags together and even going out and distributing them around the community to the medical providers so they had them, which is a great way for people to really feel connected. As the organization and the distribution has grown, which is a good and a bad thing, I guess, right? I mean, it's good that people are getting the materials. It's unfortunate that more people are needing them with the cancer diagnosis, but it obviously became a little more challenging for just to be reliant on volunteers, and especially as we go across the country. So that unfortunately isn't an easy one to do. It's always what people want to do, which makes sense. But we actually partner with the Beacon Group, which is an organization here in Tucson that employs individuals with disabilities, and they put the bags together and then they ship from there. So we're really lucky to have that partnership, but then it limits the volunteer opportunities. But we have a lot of volunteers who have helped us that make chemo caps. So we do have people that knit or crochet and put those together. And in the winter months, we ship those out in the boxes so that the providers have them. So there's a lot of people that might have those or make them, but we've got some volunteers that make some really nice colorful ones. And so those are sent out with boxes to different offices. And so they have a selection available for their patients to pick that to help keep them warm. We have volunteers that will help with some of our translations. So for social media translation, not the bag itself is a pretty big project. So we have somebody that works on that, but for some of the smaller pieces with translation, we have people that help us with administrative type things, thank you notes, the website, mailings, and then a lot help us with community events. So which right now, as we were talking about before, we aren't able to be out and about in the community, but we like to be at the community wellness events, the health fairs, at the offices, and sharing what Bagot is and what we do. And so we have a lot of our ambassadors that go through training and will come and help with that. which really saves us the small staff and our time to be out there do that, and gives other people an opportunity to support the organization. And then our annual fundraiser is Take a Hike for Bagot. So it ties in the importance of physical activity, and we get to explore the beautiful desert. And so we have a lot of volunteers that help us with that, from your typical event activities, soliciting auction items, being there the day of the event, leading the hike, helping people on the trail, taking pictures, and everything that way. So that's probably our two bigger ones, are the ambassador events and then at the hike event. But lots of other small things that people can help us with.
Awesome. So would they have
you guys, I know you, oh, sorry, Desiree, go ahead.
Oh, okay, sorry. So do they, for the different types of volunteer opportunities, would they just go to your website to find that information? Or is there like social media that you share it with? Yeah.
All of the above. So we are on a lot of the, as you have on the display there, a lot of the social media channels. So someone could message us that way. But on the website, there is a volunteer under Get Involved, and you could fill that out. And it has Lisa, who is our volunteer and event coordinator. It has her email address, and you can email her directly, or give her a call. She likes to talk on the phone, so she'd be happy to chat and find out where your interest is and what your timetable is and what works best. Because as we know, right now people might have a little bit more time as things pick up, and what things people want to do. We're looking at doing more things like this. We would like to get out in the community again when we can, and do presentations to different groups, talking about just a general self-advocacy message, not only specific to cancer, but just within our healthcare itself. And so we've got to find people that want to do that. Not everyone wants to speak in public, but some people like the one-on-one of being at an event or being an ambassador. So yes, email Lisa and set up a time with her, and then you can find out what works, what's the best fit for you and what you like to do, so that we can find a match for you.
Great. So I know you mentioned how you guys work closely with medical providers to distribute the bags. What is the best way for medical providers who are currently not working with Bagot, and how they can start getting involved to start giving out the bags to their cancer patients?
Wonderful. We would love that, because we know that, you know, one less step for people makes it so much easier. So if they have to go and they hear about us, or they have to find us on their own or whatever, that it's one more thing to do. So it doesn't always happen. So if the medical providers have the bags and can give them out to the patient, then the patient really is, and the care partner are ready to jump on board then, right? They have it from the get-go, and so it makes it easier to get started. And so we are happy to work with them in whatever way we can. So they can reach out to us. Our information's on the website, or they could email myself or Joyce, and we would sit down and meet with them and talk about what really works best for them. So for some providers, they give out the bag exactly as it is. We make sure that they have English and Spanish. We can set up monthly auto orders, you know, so that, because they know roughly how many they use, and we can then they don't even have to think about it. They just show up at the office regularly. We can customize them, as I talked about, that we're working on with a few providers, on whether it be they want to customize the bag. So there's, you know, the hospital in Nebraska is going to do a customized bag, so it targets where they are, and then they have the same binder information, but then they've got some of the information inside customized to their facility. So similar to what they might put in a new patient information packet, but instead of having multiple things to give to someone, they can have it all in one nice clean place for them. So really, they can reach out to us, and we will sit down and set up a meeting to go over the different options, what they're looking for. We do ask for medical providers to cover a portion of the cost. The bag itself in printed format, which is preferred, but it obviously is a little bit costly, does cost us about $40 for each bag. And the Spanish bag, because we don't print as many, is about $50. And we ask, providers to cover a portion of that. And then we are always doing, fundraising and grants and personal donations for the rest of the cost of it. But we want to make sure that patients aren't having to pay for it if we can.
So are the bags, are they mostly primarily in Arizona and Nebraska, or do you guys have baskets all over the country at different medical providers?
They're strong in Arizona because that's where we were founded and that's really where our focus was. But about 2 years ago, when we revised the bag and extended the content to really be beyond, it was really initially designed for that newly diagnosed within that first 18 months. And not that it still wasn't helpful later on and definitely kept you organized, but that's where a lot of the focus was. And now we've extended it when we decided to, as a board, decided to let's look at this nationally. We had a lot of interest at the national level, and so we wanted to see what that looked like. And so we revised the 2019 version. Now extends throughout life. So we have information on after treatment, active treatment ends, living with chronic cancer, practical matters of going back into the workplace, and so all those aspects of survivorship. And so we're just starting. Last year, we really kind of launched that new version. And so we've started with some of those partnerships, getting the bags out to across the country. So it is available throughout the US in both English and Spanish. And that is growing every month. So lots of opportunity there, but it's not heavily in those places as of yet.
There's a section there about, especially with the whole outbreak right now, things that you can do to keep yourself healthy as a cancer survivor, someone with a compromised immune system.
Definitely. I mean, and that's why, the bags are shipped out. And so we can, people can order one, and even locally. So even though we tend to have them here in Tucson, we can deliver them straight to people. But it is definitely, as you said, it's information that we still need to keep track of. And we're seeing a lot of times, we see people that aren't seeing their providers on a regular basis. If you're on oral chemo or something, or right now where you're maybe trying to keep yourself in between appointments a little bit longer if you can, but still keeping track of, there's pages in the binder on keeping track of your side effects or logging what's happening in your medication. And that's even, not that it's not always important, but right now, determining what information do I need to keep track of so that I can make sure to tell my medical team, my healthcare team, this is happening, so we can look at what is it? Is it my chemo effects? Is it a treatment? Is it am I getting the flu? Do I need to be cautious of this? Where is all that come into play? So it is definitely important to have all that information. And long term, I think one of the things about the bag that, we think, oh yes, I'm out of treatment, I'm good, which is awesome. But, down the road in 10 years, it might be important to know that I tried this, I had this radiation, or I tried this treatment and I had a really bad reaction to it. And we're not always going to remember that 10 years down the road because we're in a whole new place. So when, unfortunately, if there's a recurrence of something.
That's a good resource, yeah.
I know our founder, I think Sherry says she's on her 3rd or 4th binder. So she just kind of, and not that, she's been in good shape, but keeping track of all your scans. We have people that go to appointments and sometimes all the systems don't talk to each other, as we know. And so when you show up at an appointment, if your results haven't made it there, you might have to postpone an appointment or something. And right now, especially where we're trying to limit our interactions, having that information with you. So we're always encouraging people to print out, even if everything's on a portal, print it out, keep it in your notebook, take your most recent scans or information with you to those appointments so that you can have it there. If for some reason the medical provider doesn't have it yet, you can pull it out and show it, and then you can continue the conversation.
Great. Keeping on the topic of COVID, how has the current pandemic affected your current outreach efforts?
For us, we're still trying to get out there. So patients are still being diagnosed. one of the key things that we've tried to do is to let our medical providers know that if they aren't seeing patients or if they're doing a virtual conversation with them, that we can still get a bag to them. So the system, the USPS and UPS are still delivering at this point. That's still seen as an essential service. And so, as well as where the bags are at Beacon, where they're being put together. So we are still able to deliver bags to patients. So once we have their address and contact information. So we're letting people know that that is available and communicating with them that way and getting it out. And then we've been trying to, especially here in Southern Arizona, we are part of a cancer collaborative of nonprofits that are in Southern Arizona that have support systems for individuals with cancer. And so we were just in the midst of putting together sort of a resource page to share with the community and medical providers of all of these resources that are out there. And so we've done a quick modification to update it specific to COVID. And so here is, because some of them maybe have had to change their in-person support groups or their services, or they might, depending on how contact oriented they are, some of them are massages or whatever, are on hiatus at the moment. So we've done an updated resource sheet to share with the medical providers. And we just got that out this week. So that's getting on the Bagot website under state resources. And I know some of the other organizations are sharing it with their medical team practices that they work with. And we're trying to communicate that so that people are still aware that there are still online support groups that you can attend if you're needing that there are still ways to get the Bagot bag, but also to get the other pieces that you might need, the resources that are out there.
So I know when Desiree asked about different ways how people can volunteer, and you mentioned a run that you guys do, but can you also tell us a little bit more about the Escape to Thrive conference?
Sure, and actually, and that's a hike, so, and it'll be October 25th, hopefully, which is our big fundraiser. But the Escape to Thrive conference is a leadership conference for cancer advocates. And so it is a national program, and it has been, we've actually done 9 of them. So 2021 will be our 10-year celebration. And it's designed to bring together advocates across the country who are often, it's changed over time. The goals have always been for collaboration, capacity building, and self-care for those advocates. The majority of the advocates that attend are survivors themselves, many of them have started their own nonprofit, or they're doing public policy work. And so we're looking at, one, how they can continue to take care of themselves. And so that's the self-care part that is so important, that they're giving, and we're trying to support them for that compassion fatigue or just that burnout, so they can continue to take care of them and the others they support. And then capacity building, so pulling their organization together and expanding their reach and how they're helping others. And then collaboration, and we've seen a lot of that as well. So I know that we're fortunate to have Dr. Yellow here this year as a speaker at the conference, but people are coming from specific cancer types. So whereas, you know, Bagot is across cancer types, a lot of times if you are a lung cancer patient survivor, or breast cancer, or thyroid, that that tends to be where your focus is. And so we want to have people collaborating and build that capacity to recognize that a lot of the challenges that they might be facing within their organization or their cancer type are across the board. So getting patients to treatment or involved in clinical trials can be challenging wherever you are. And so it has been, it's a very different experience than most people go to when you think of a conference, in that we try to find that balance of professional development as well as personal development, and the growth that comes from that, and taking care of themselves. So this year, one of our days where Dr. Yellowhair spoke, we talked about equity and inclusion. And so we looked at Native American, we looked at African American, we looked at Hispanic, and then the LGBTQ population, and how that is impacted in just treatment and clinical trials and everything. And it was the response that we got to that on that day, people were just very, very, their eyes were open. They learned a lot about it, especially I think because they're coming from other places where maybe the Native American population is not as strong as it is here. So when you were speaking, Dr. Yellett, people were like, they had no idea. And so it was very powerful to see that, to recognize that. I mean, it's unfortunate, but this is our goal, is that these people see these challenges and see how they can help make a difference and what they can do within their organizations and within their communities, and how we can all work together to help make those be less problematic.
Yeah, I enjoyed the conference, especially that day that we were there and learning, especially about all the different health inequities, and especially amongst the LGBTQ community. It's just something that I never really thought about. So it was a really great discussion. And I also enjoyed the activity that we did afterwards, and where everyone broke up into little groups, and then we had given social determinants, and everyone had to figure out, we were given a case study and then figuring out what are ways, barriers that things are working against that particular case study. So I thought that was really interesting, and just listening to everyone's experiences, especially talking with other cancer survivors and just hearing their stories, was really, really impactful. So I really do enjoy this conference. So if anyone has the opportunity to go, I would say go.
It is unique. Next year will be our 10 years. We're actually inviting back the alumni. So those that have attended in the past, as a chance for them to come back and do some teach the others and share what they've done and how the escape experience has taken them forward to what they're doing now in advocacy or within their organizations, and also talking about some of the different projects that individuals have done from there. Like I said, the Hope for Stomach Cancer, the Hope in a Bag, stemmed from that conference, and that Aki had attended Escape to Thrive. But there's also been research papers being done and partnerships and collaborative efforts across so many channels that have stemmed from that. And so it's been great. So it'll be nice to see it all kind of 10 years come to fruition and see all of that amazing work that's been done in the advocacy world. And then also looking towards what that's going to look like down the road. I mean, we've had a few years where we did a lot on public policy, which at different times is always very important, but at certain times it's a little bit more prevalent in what we can do as cancer advocates to get out there and support that policy.
Thanks for sharing more about the Escape to Thrive. So, thinking about cancer survivors, do you have any encouraging words for someone who may be newly diagnosed, current cancer survivors, and their family and caregivers?
Always so hard because everybody is so different, and everybody is at a different level of what they need and what they want to hear. And I know that everybody needs to find what's going to work best for them. But I think for everybody, we're firm believers in being knowledgeable is going to help you be part of it. So taking the effort to learn a little bit more, and if you're not ready for it as the patient, the caregiver, and being out there and knowing that your healthcare team wants to hear from you and they want you to share the information and ask the questions. And I think sometimes we as individuals think that that's not the case. And it's so important for them to really know what is happening with your body, because you're the only one that knows that and that can tell them that. And so it's important to share that information. And I think just continue to be the best that you can be every day, and know and acknowledge that you're going to have great days and you're going to have not so great days, and to be okay with that, and for the people around you to remember that that's okay to have a bad day. But we really, that we work hard. The medical providers, the oncology community is out there. They're at the forefront with everyone else, and they care. They work hard. There is so much changing in oncology every day that it's hard to keep on top of everything, but they're working hard to support their patients and the families, and to adapt their practices and their treatments to make sure that you're getting the best care possible. And I think especially right now in the midst of COVID and people not coming in, you know, they're trying to figure out how can we still support you. We want you to come in for your treatment or your appointment, but we're trying to limit contact. And so, you know, I know a lot of practices are trying to set up Zoom so that any other family members can call in, but you have one person with you, because we know that support is helpful. So I think, you know, our keywords from Bagot, we're always just, you know, we're sending positive vibes. We're always sending well wishes. We know some people are alone. And so, you know, if you just need to call and talk to somebody, find somebody to talk to. And if you don't have that person, just give us a call at Bagot. We'll answer the phone and talk to you, or send you a note. And it's challenging all the way around. But I have seen a lot of great social media where the individuals with cancer are talking about how everybody with COVID, it's like a whole new world for them. And that those cancer survivors are like, oh, we've been here, we've done this. We can understand how to sort of isolate or limit our contact with people for a while. And now it's our turn to really thrive and show everybody else how to take this. And so remember that there is light, and that you've got this, whatever level that is for you, that just take it and tackle it the best that you can.
So I know right now, currently, Desiree and I are working with Joyce from Bagot to help develop a Bagot specifically geared toward Native American communities. And so what are some other ways how our office from the Arizona Cancer Center, the Community Outreach and Engagement Team, how can we also support your efforts?
Which we're very excited about to have both of you helping with that. I know that it'll be a little more challenging than we think, but I think it would be such a recognizing, you know, as we talked about, different communities have different needs. And so we want to make sure, as we said before, that the bag is accessible. I think one way is, you know, on your taco lunch webinars that you're doing in Spanish, I would love if, you know, because I know that you said that that's a big group as well, letting them know that the bag is available in Spanish, and that one of the website pages does have resources in Spanish, because I know that they're hard to find. So letting people know about that. We are working on, well, we did just recently get things printed, but of course distribution, but we've updated our marketing so that the information is in Spanish and in English. And so here's information that we can have. So for providers and offices or community areas that maybe aren't able to provide bags for whatever reason, but that they could at least have, you know, wrap cards or brochures or something about Bagot and letting people know about it. So as you come into contact with someone, letting people know they can order them. So I know, you know, my mom's in Ohio, so when she has a friend diagnosed, she gets online and she orders a Bagot bag, and she tells her friends about it and shares the posts on social media as we try to continue to post that. So any of those are great ways that you can continue to support us. Inviting us to your events, as you've done. I mean, I know that we're involved in the collaborative and in the community advisory board, but also, you know, some of the community events. Once we're all back out there at the different walks and health fairs and everything, and you know, we're always there to have a table. And as I said, one of our other goals this year, which, you know, might get pushed to next year when we can be back out, but is to really talk about self-advocacy in general. So sort of expanding what we've done with Bagot and cancer, and really empowering individuals with a cancer diagnosis to speak up, but how we can just do that, being your own best advocate for your healthcare in general, and how important that is, and why it's important to speak and communicate with your healthcare team. And I think even more so as we move towards telemedicine and telehealth type opportunities, that it's going to be important for people to keep track of what's happening in their life, to communicate it with their medical team so they can properly help and support them. So I think just communicating there, helping us get the bags out and get the word out is so helpful for us.
Well, if you guys have a Spanish-speaking team member, we would love to interview them with our Let's Talk About Cancer, because we can conduct these interviews in both English and Spanish. So we are available for that. So I like to just give that little plug there.
Not a staff member, but we have some fabulous board members and volunteers that maybe, actually, I think you spoke with one of our board members last week, Lorena Verdugo. And so
Yeah.
on your Spanish one, but not about Bagot. But so maybe we could get one of our board members or one of our volunteers that would be willing to do that and talk a little bit about it. Would be wonderful. Thank you
Great.
for that opportunity.
Mhm.
Awesome. So, does Bagot accept donations, and can you share some more information about that?
Of course, we accept donations. So as I said before, that we want the bag to be accessible to patients and to be free to them. And so we do have, we actually have our current fundraiser is a give a bag. And so we ask people to make a donation, and it's a direct donation that goes to help cover the cost, 100% of the cost for individuals that might not be able to afford a bag on their own. Because as we know, cancer can be very expensive, and so it's sort of an excess piece, but we want to make sure that a lot of times our individuals that might need the bag even more so are at a more financially compromised position. And so you could go to our website, bagotcancer.org, donate. There's a donate button at the top and make a donation there. You could set it up to be a monthly donor through Workplace. We have a number of individuals that give through their Workplace, and then they also match them. So that's always phenomenal. If you're perhaps with a business that would like to do a bigger donation for our hike or just in general, we're always happy to have those as well. So individual donations participate in our hike and in the Give a Bag program, and would be wonderful. Or, and again, just even ordering a bag for someone. So you know, if you know someone that's diagnosed and you want to give them a bag, it's not a direct donation, but it's supporting the individual that way as well.
Great. So before we open up to questions, we'd like to show up our upcoming webinars that we have. Tomorrow we have Dr. Peter Lance from the Arizona Cancer Center, followed by Dr. Jennifer Erdrich and Dr. Jennifer Hatcher next week. The following week we have Lesbeth from Cancer Support Community Latino Outreach, as well as Dr. John Molina from Native Health. And so with this time left, we'd like to open it up for anyone if they have any questions for Mindy, as well as to see if we have any questions on our social media.
Hi, Mindy. This is Octavio. I am one of the health educators here with the team, COE at the Cancer Center. I did have a question. You mentioned that cancer can be very expensive. I know that this is one of the biggest, you know, hurdles or anxiety-inducing things that you can get along with getting the cancer diagnosis. And there's even a TV show that was centered around this called Breaking Bad, where a man who is a chemistry teacher gets this cancer diagnosis and he resorts to cooking meth, putting his chemistry skills to use in order to be able to pay for his treatment. So a lot of the memes and the jokes made about it is that if that show had happened in Canada, it would be one episode long and it would not resort to you know, the seasons of crime that continued. But so what can we do to advocate for maybe policy change or support the fact that can be one of the biggest hurdles to overcome, especially for those that are less financially well off?
That's a great question and a difficult question. First, I want to say that there are a lot of resources out there, but it does take obviously some time and energy to get them. A lot of times working with maybe where your medication or your drug is coming from, that a lot of the large companies have some extra foundations and support that way. And like I said, our website and the resource page does have some financial aid opportunities that are out there. So there is some of that, but I think policy-wise there's an organization, NCCS, National Coalition for Cancer Survivorship, and they do a lot on the public policy field, and they actually have been to Escape to Thrive and talked about public policy and recruit for some of their advocates for their policy, their CPAT team, to go out and do that. And I think being alert and aware. So when we're seeing information come across about signing this, I know a lot of us are hesitant to, oh, I don't want to get involved in that, or I don't fully understand it. But how can we learn more about it so that we can make those changes and recognizing what is happening and getting out there. So I think it's really just at this point, because I'm not a policy expert, so it's trying to be more aware of it and to get out there and do what you can. And that's one of the pieces that we haven't done a lot of in Bagot. I mean, we talked about it at the conference, but at a level there, but we are trying to become more aware and try to share that information so that people can support the advocacy efforts and the policy efforts that are out there and learn about them and find out how can we make healthcare more affordable for us, and for those that, not that we don't all need it, but if we're not in a place of employment that might have that or something, that it's definitely more challenging. So how can we get that support out there? So I don't have a great answer for that aside from working on it and continue to educate yourself on it, right? So that you can find out what's going to work best for you. And I think when something isn't happening to us, we don't think that it's something we need to worry about. So for a lot of people that haven't maybe been impacted by cancer or another chronic disease or a health issue, that they see it on social media or they see it in the news or across their email, and they don't acknowledge it because they're like, oh, that doesn't impact me. And so remembering that it might not impact you today directly, but it does impact you or someone you know today or probably tomorrow. And so taking that next step to learn more about it so that you can make a proper, solid decision.
Yes, excellent, because that's what I was thinking about. And yesterday we had Dr. Omar Contreras, who is the program director of policy and translational research. And so he was talking about, exactly what we can and cannot do in terms of us being part of the university. And you're right, it's the education piece, the providing a platform to share the stories that we're encountering that patients have firsthand. And especially now when a lot of people are losing jobs and those jobs are tied to their health insurance.
Definitely, that's definitely, I mean, it's nice to see some of the companies that are having to furlough people or do things, or at least still extending benefits at this point, but knowing that there's a lot of people that they're not able to do that for, and that can be really challenging. So yeah, education is key in a lot of aspects, and properly educate, taking that extra few minutes to learn about something, and remembering that just because it doesn't impact us today doesn't mean it won't.
Absolutely. Thank you so much. So I don't see any other questions on our social media.
I have one quick question again, Mindy. I'm sorry. You may have mentioned it, but does your bag also include like stories from cancer survivors where they can share their experiences in the book, in the bag?
I'd love to have more of those. We do have a few little quotes in the bag and everything. But more of that, we're trying to get on our website, and we've talked to people. We have a nice video that has some great testimonials about how people have used the bag and how the bag has helped them and their family. But there's a few uplifting pieces in there and talks about how specific to the bag of that. But on our website, we share some and give people stories that way. One of our biggest challenges is that because the medical providers are giving out the bags a lot of times, which is great because, as I said, then people are getting it early on. We often, as the organization, don't hear back from those people or know how the bag impacted them. So we have a feedback form in there and available on our website, but it's one more thing to do and people aren't always thinking about it. And so we're always trying to, when we're at those those community events and people walk by and they're like, oh, Bagot, I got a Bagot bag, it was great. We're like, come here, come talk to me, can I get your story? Because we want to hear how it worked or didn't work for people so we can enhance it, but we don't always get that feedback. And so we are, one of our big goals right now is to figure out what are some other ways we can reach out to people early on to get that from them and work with our medical providers to see what information they can give us about those. So we have some stories in there and on our website, but not as many as we would like, because that's the powerful part of it.
Yeah. Okay, well, if anybody else has any more questions, I'd like to thank our guest today, Mindy. Again, thank you. And I also like to thank my co-host, Desiree. And so I guess I'll give it a minute or two to see if there's any last minute questions from anybody.
And I know I said it at the beginning, but I'd really like to thank you guys for the opportunity for us to share about Bagot and give people more information. And don't hesitate to email us or call us with any other questions at any time. And check out, if you have a bag, check out our video, both in English and Spanish should be on there by the end of the week because it just finished, but how to make the most of your bag so that you can really find it the most beneficial for you as well.
And again, thanks for the invitation to have the opportunity to speak at the Escape to Thrive conference. It was a really wonderful experience and opportunity. So
it was very enlightening.
Okay, well, if that is it, I guess I will end the meeting here. So thank you.
Thank you. Have a great day.
You too.